नहीं डिस्प्ले तो आ रही है, 1 मिनट ऐसे रखिएगा ना।
स्लाइड और स्पीकर के साथ कर दो ना, स्लाइड यही वाली कर दो, स्क्रीन
सर
शेयर।
इसको ऐसे रहने देना।
ठीक है।
अब स्क्रीन शेयर कर करना, ऐसा करना सही लगेगा।
So purpose is first not to prove a causality. Second, key our main purpose is to generate a hypothesis and our reasoning. Why did we publish that particular case? We took insight into that, and to highlight any rare or unexpected events in that case. So historical importance. If you look about that, key first recognition. We all know AIDS. The first one, like initial case series, we started with AIDS. Then we had thalidomide-induced birth defects. Then we had new drug adverse effects. Okay? And many randomized controlled trials. They started with a case report. So basically, our message should be that key case reports should start conversations, not conclusions. The question is to why. Okay. Now, when is your case publishable? Your case is publishable if it is at least one new disease or variant, rare manifestations of any common disease, a novel approach towards that particular diagnosis which you have made for that case, any unexpected complication or adverse drug reaction, or any strong educational value. Okay. For example, suppose we get a young patient. Okay, we day to day, we are driven by social media. We see a patient in his second decade collapsing, working out. Okay, it has become common. Okay, so like we said, like why the young patient? Why did he collapse? Why did he had a certain cardiac arrest? So comes to your mind vasculitis. Okay, first thing. And apart from that, now vasculitis has many variants: small vessel, large vessel. But exactly why that patient? So that is key. Yes, कि हमारा the term is जो diagnostic dilemma है. We're still in a dilemma. But yes, now we have to make a research on that. Why that patient? Okay. Now, first thing, when a case is publishable. Now, when a case is not publishable, first case from my hospital. We are a tropical country. We have a lot of diseases. Okay. And it's not that, oh, suppose it's my first day in residency, in my first day in hospital, I got a patient of dengue, DHA fever, I should publish. No. Not the first case. Okay. And any common diseases. We don't have to take any common diseases. Okay. Data is already there. It's a textbook publishable data apart from that disease. And third, you save a sick patient. This line is very controversial, that you save a sick patient. Others that too. But yes, this line, what did you do? What was your novel approach when you saved that patient? For example, I have a patient A. Okay. The world is treating that we have guidelines, like we have to do this and that. Oh, we have guidelines. Every year we get publication data, there are guidelines, sepsis guidelines. But yes, apart from that, in an ethically driven manner, you did something which made the course of the disease in favor of the patient. Then you can, okay. And fourth thing, no follow-up data. You publish a case, you make a poster presentation, you publish a paper. The first thing, the judge, whosoever, they ask you, they are like, what was the follow-up data? No one likes to listen, patient lost to follow-up. Okay. So we'll be like, okay, आपने ना data जो है अपना textbook से ले लिया. What exactly did you do? Follow-up data क्या था patient का आपका? ठीक है? If there's no follow-up data, your case series is null and void. Then no clear learning point. If and search, suppose, for example, you're on rounds, you come across a point. What do? You just Google up. First thing that comes on your feed is that particular thing which you're googling, कि evidence है उसका कि नहीं, evidence data आपको मिलता होगा उसमें, ठीक है. There are many sites, Medscape, and the first thing is you all know Medscape comes to us, that कि हम जो भी हम कर रहे हैं Medscape आता है उसमें, ठीक है. And उसमें what we look for, कि हाँ, what we are searching and what the data is providing us, we look for it. नहीं होता तो we just keep on shuffling the pages and everything. If your case has no clear learning point, there's no point for publishing that case. And consent not obtained. Consent foremost is must. You should have a patient consent first. If you don't have a patient consent, your case is not publishable, and that will land up you into legal troubles as well. Okay. And the last line in that case, does this case add something new or merely describe something known? We have, suppose I had a patient, and for example, he developed subarachnoid hemorrhage. Okay. And now what we know about that in patients of SAH who are diabetic also, we have to maintain a amount of regular blood sugar, something around 170. Okay. So what exactly हमें क्या मिला उससे वो करके, ठीक है. So whatever treatment we are doing, तो उसमें that कि हम जो भी कर रहे हैं, हमारा case is adding something new to already known thing, plus point, and something known जो हम उसको और describe कर रहे हैं in detail. Next, we have single case versus case series. Single case, exceptional rarity, ठीक है, and there is strong mechanistic insight. We have something like हमें data में कुछ मिला, patient, we are treating a patient, and something we made a rare diagnostic. Okay, and we just have 3-4 cases, known reported cases in the world about that patient. So that is a single case, which is an exceptional rarity. Now, case series, more than 3 cases of the same. Okay? So in case series, we have to recognize the pattern, okay? And better acceptance rate, and we have to allow simple descriptive stats about that case that we're reporting. Okay. Now, coming to ethics, consent, and legal safety, which is foremost. Ethics is not negotiable. Okay, consent is mandatory. You have to de-identify the data, and your journals, they may ask for proof of the data which you are submitting. So as per the guidelines which you have received with ICGME, COPE, ICMR, which is Indian. Okay. So now why this matters? Why ethics is non-negotiable? Case reports involve real patients, real identities, real risk, and our ethical lapses into this can lead to rejection from the journal, institutional action, any legal liability which you may face, and any loss of professional credibility. Now, since last few years, there have been increased global scrutiny by the journals, usually the ethical committees and patients themselves. So now, as a resident, they know that when you submit your thesis, first you get a topic, you propose your topic to the committee. What's that committee? That's an ethical committee. What's the role of that committee? Ethically wise, is your study that you're doing is patient compliant, first thing. Patient compliant, and secondly, ethical wise, what benefit is that your study providing to the patient? Okay. Now, what makes our case report unique? Ethical sensitivity about that particular case. Single patient, usually we face issues that care a single patient hai, so there's high chances of risk identification. Okay, any rare disease, any unusual images, timelines, which leads to our easier recognition. And usually our patient, sometimes they may be critically ill, they may be deceased, they may be lost to follow-up. So hence, we need to have a stronger consent and privacy guidelines if needed for that. Now, what are our core ethical principles? Ethical pillars in case reporting are: first is autonomy, patient's right to decide. Whenever you go for a study, first thing, you have a patient consent form. Is your patient willing to be a part of the study? This is the most important thing. The first thing, autonomy. Patient has to right to decide whether he or she are willing to be a part of that study. Okay. Second, confidentiality. You have to protect the identity of that patient. Okay. Recently, few years back, we used to say that I have a patient who is HIV positive. Now we no longer say that the patient is HIV positive. There's a term PLWHA, patient living with HIV/AIDS. We don't say that patient is HIV positive, So there's a term. So yes, confidentiality of the patient and protect the identity of the patient. And null maleficence, no harm from publication. Suppose I got a patient and I found something rare. I published it. I made a point that, okay, I got this thing and I had a patient and he or she was suffering from one communicable disease. And my patient was living in that particular society and that particular area. Okay. So these things may lead to. Okay. So third, non-maleficence and transparency, honest reporting. If you have a patient, you have a case, whatever you have the course of the stay in the patient, whatever you're treating the patient on OPD basis, IPD basis, there should be transparency. Okay. It's not like suppose I had a patient, just coming back to vasculitis. So I had a patient, हमने ऐसी वो hypothetically publish कर दिया कि 27 years का था and हमने उसकी वो कर दी biopsy करी and सारा हर एक चीज. But did we actually do that? Hypothetically नहीं करना है हमें. So there should be transparency. Your report should be honest and accountability. You should be accountable for the research that you are doing. Now, coming to informed consent for publication, consent must include the purpose of your publication. Second, online and global access, that depends on the author and depends on the journal that you're publishing in. Whether it's a free database or it's a paid database. It's the sole decision of the author. Where do you want to publish? Okay. Then use of images and limits of anonymity. Now, there are few situations where you need spatial consent. First, pediatric patients. You're reporting a case on a pediatric patient. So you need to have a consent from the parents and the guardians. Okay. And assent from child whenever appropriate. For second, a deceased patient. Suppose your data is driven on a patient who had been under your treatment and now the patient is no more. He's deceased. He or she is deceased. So we need to have a consent for the next of the kin and gather documents if available. Third, unconscious ICU patients. Deferred consent. Reconsent when the patient recovers and lost to follow patients. Okay. Now, these are a few de-identification rules. First, foremost, we have to remove the name and the initials of our case of the patient. Hospital numbers, we have unique hospital IDs. Okay, we have to remove that from our case series. Exact dates, facial features of the patient, and rare identifiers. Rare identifier means any birthmarks. Okay. Now, as per ICMR, so in 2017, ICMR came up with new national ethical guidelines. So usually, if we are going for a single case, we don't need to get a IEC, ethical committee approval. Okay. Usually, what the institution that you're working in, if they have ethical committee, their approval, it matters in a single case, and always a document decision. Now, okay, so we'll just go through the checklist. First, novelty. The case should be care compliant, consent should be obtained, data de-identified, and a right rental. Okay, so I think next Dr. Yashendra Sethi will take over from when to how to write a case report. Okay.
Sorry for the interruption. I'll first thank Dr. Apoorv sir for his detailed insights on what case to publish and what not to publish. Because for any publication, that remains integral, that what case we choose. Because unlike research, for case reports, it's very important to know that the type of case we choose entirely decides whether it's going to get published or not. And the second thing we discussed was about the ethical guidelines, which is very important because without consent, we are just getting into legal troubles and not helping either the patient or us. So now we'll jump directly to how to write a case report. First golden rule that most journals now are compliant with the care guidelines. So it's in the betterment that we follow care guidelines. Care guidelines are case report guidelines. These form the global reporting standards. We'll quickly brush through them. So just like another article, for case report 2, you need a title followed by keywords and an abstract. The abstract has to be aligned with the journal guidelines, and it can be structured or non-structured. Then with introduction, in introduction, the idea remains that we introduce the problem first, and then we discuss about how our case is different in terms of the management and in terms of the way the case presented to us. The next thing is patient information or the case presentation, followed by the clinical findings. So the clinical findings have to be detailed and have to be in alignment with the reporting standards for that case or that specialty. Then it's better to include a timeline. In the timeline, it's not important to introduce dates, but you can write that in terms of the days of presentation. Like if the patient presented, that may be the day 0, and after that, on 6th day, on in 1 week, in 2 weeks, what were the changes expected after the treatment you followed? Then a the therapeutic intervention which was taken up and the follow-up. So all these have to be reported in this checklist, and this has to be uploaded along. So we'll go through all the headings one by one. First, the write-up has to be informative and not sensational. We have a habit from our English classes that it has to be written in a fluent way and it has to match some grammatical brilliance, but that's not the case which is acceptable with scientific literature. Academic writing is an art, and that has to follow a way where you convey maximum amount in minimum text. So for that, every line you enter in your manuscript must be written in a way that it communicates something and it has a purpose. Extending the length of manuscript does not help, and most editors don't like it. Now, you have to mention the disease and you have to convey your key message through your case report. As Sir told, that a case report is not something to generate a causality, but something to generate an hypothesis. It's an observation which has something new to contribute to the current body of literature, and that has to be portrayed in the same word. Now, in the title, it's important that you include the word case report or case series so that it's indexed in an easier way and it's taken up easily. As told, in case series, there have to be minimum of 3 cases. And for a case report, it has to be an interesting enough case that it adds to the current body of literature. Now, for the title, if we follow all these guidelines and we keep it informative, we mention the disease and we include the case report, a better example could be that air pollution triggered acute coronary syndrome, a case report. Rather than writing a rare and interesting cardiac case or pollution caused cardiac death, you are not writing for news media, you are writing for academic literature, and that has to be taken care of. So the next part is abstract, as we discussed, that mostly journals want a structured format now. So the headings which are used are background, case presentation, and conclusion. This can also be written in an unstructured way if the journal demands for it. So different journals have different guidelines, and it's better to choose a journal in advance before starting your write-up. That gives a direction and prevents time wasted in the journal tailoring. Now, introduction, as we discussed, it has to be short and concise. Start with what is known, then what is unknown, then why this case matters and what this adds to the current body of literature. You can also highlight some gaps in literature to support your command. Then you have to avoid textbook reviews. It's not important if something is very common, you have to bring it on and just talk about it again. For a case report, your introduction must bring it to the capacity that this is the body of literature, this is what's done, these are the current guidelines, and this is how my case stands differently. And I will be discussing this case now. So that's how your introduction must end. Now, talking about the case presentation. As medicos, we have been trained in history taking, and it's very similar to how we report a case. But it has to be done a bit differently. Like when we take history for presenting in an exam, the way we do it is we start with history of present illness, then we take past history, then we take any history of comorbidities, family history, and other personal histories which are important. But for a case report, you start by introducing all background history and all important comorbidity history at the start, and then you bring down your case. That's how it goes smoothly, because that's a way which forms a better story. So if I'm telling you about a patient, it's better that I tell you about the patient first, then how the patient presented and how the situation evolved. So that's the better way to do it. This is one of the case reports we had where the patient had black hairy tongue. BHT is the rare side effect of linezolid. So this is the way we have started it. A 28-year-old female. If she had any comorbidity, I would have mentioned that here. Presented to the breast clinic with redness and mild pain in her right breast. On examination, these were the findings, and past medical history and the remainder of examination was unremarkable. Had there been any finding, I would have given that at the start, right? So this is the way to write the case presentation. You follow the same chronology. You talk about age, sex, the presenting complaint, history and examination, investigations, management, and you end by outcome and follow-up, right? Then timeline. It's recommended by most journals now that you introduce a timeline. As we discussed earlier, that for a case report, the timeline must be in terms of day of presentation and not exact dates, because that somehow makes it traceable for others and compromises patient safety and anonymity. So these are clinical timelines which have been drawn by some authors. You can also make a table, but these are better ways to do it. Diagnostic reasoning. Now it's important that you explain how you reach to your diagnosis. This mostly forms the core of your novelty, because it's very rare that you'll find a case which is extremely rare or has probably less than 100 cases reported worldwide. But at times we have a case which presents a bit differently, and then through your diagnostic reasoning, you reach a case. So that is something which probably is easier for a case report to contribute. And if you spend time on writing this part, that improves the chances of your publication and later citations of your work as well. Because if you are contributing a different approach to a same case, that helps other clinicians around. Now, discussion. The next part is discussion, because once you've written the case, now you have to compare that with existing literature. For that, you start by saying how your case was different, then how others would have managed this case, or what the guidelines suggest, and then how your case was managed and how that was different from the current literature. Right, and you end that by possible mechanisms if something was different, or possible hypothesis if you have managed things differently and have a thought on why you did that, then limitations, and you end by talking about the clinical implications of your work. So another thing which I like to bring in as an editor is that for any scientific manuscript, the language has to be in best alignment. It's very normal in foreign countries or for the native speakers to know that the flow of language is important. But for non-native speakers like us, we do not use correct voice and tenses at times. For any journal or for any write-up, if you're reading a text and you want your audience to have a good flow at it, you have to use more of active voice. Somehow, when we translate from our language, which is based on Devanagari script, it gets more into passive voice, which makes reading difficult and troubles your chances of getting your work accepted. These are minor things, but these matter a lot when someone with native language is reading it. Then conclusion, as we all know, it's like concrete message, and it has to be clinically actionable because you're reporting a clinical case. So your findings must add like what a clinician must improve in such cases, rather than just saying that we found a case, we did this, and we are done with it. You must be contributing that this was my learning point, and this is what may be contributed to the current body of literature or current practice. Now, figures don't only add to your current literature, but they also beautify your workup. So if you have images from the patient and they can be labeled, they must be labeled. If you do not have images, illustrations can be added. There are now AI-based softwares coming up which can add to it. Now, before we get into journal tailoring, I'll just give a brief on what can be done for references. Now, for writing your discussion, it's important that we have a hang of how we go through the literature. So reference discovery stands the first part in writing a strong discussion. So for writing a strong discussion and finding good references, you need to be able to create a strong search strategy. So you all might have heard of PubMed, but I feel it's important to give a basics on how to search on PubMed. Like if we are doing a case on linezolid-induced BHT, I cannot just write and search the linezolid BHT. It won't give me enough literature, right? The literature is, if you can see, it's searching BHT, it's searching linezolid, but it's not aligned. You are finding literature, there are like 5,000 research articles, and practically you cannot go through all of them, right? So for that, you need to have a strong search strategy that refines your search, right? Now, for a specific type of reviews, what we call systematic review, the search strategy is defined and that has to be quoted in literature as well. We won't go into those details. I'll just show you how to do a basic search. So on the homepage of PubMed, you just need to click advanced. And then you need to know how to use these Boolean operators, which are and, or, and the. So for linezolid, say we added linezolid here. Now, next thing we want is that BHT or black hairy tongue is searched with linezolid. So you add black hairy tongue as a side effect, and you add it with an and, because when you're using the Boolean operator and, it is searching both the terms together, right? Now, say I have a different word for it. BHT is a common word which is used for black hairy tongue. So I'll use or here, right? Now, if you can see, or has been added here, right? Now, if you give that a search, the results will be more defined. See, the first title is linezolid-induced black hairy tongue. Next is drug-induced black hairy tongue. This will have linezolid included in the text also, right? So your first few results will be stratified better if you're using a better search strategy. There are more details to it, but I feel this is the basic everyone must know, right? Then now, in the current capacity, we have AI in everything. So there are AI-based softwares which are helping. Research Rabbit is one of them. So if you search, say, linezolid BHT on this, it gives you a better search engine, and it also gives you a better way to portray your literature, right? You can see the results are in the same order as we had on PubMed. So it's no different there, right? But once you click on it, you can just click similar, and it will help you find similar work. Now, here you can see in this web map that it is also showing you that what literature has cited other, right? So from this picture, you can easily see that this research by Govitz has been cited by all of them, right? So this probably is a very landmark paper on the literature and must be a part of your discussion as well. And now with the years listed, you can see that the first case reported on this was probably this 1953 one, which is through Burnaby. And the last case reported was in 2021. So just by AI, you can see how the literature is spread on the topic. Now, if you get a case on linezolid-induced BHT now, the last reported case is 2021. The one I reported was in 2019. So you can see the difference that after 2021, no case has been reported again. So that can be a way to find out that this is in the right direction, right? You can also have this listed, right? So all these articles will be listed. So this is one way to do it, right? Let's go back to our presentation. Now, the next part is once you've written a manuscript, you must be in a state to submit it. For submitting the manuscript, it's important that you align it with the journal guidelines. So every journal on their portal have a specific section called author guidelines. You need to go through that section and understand what the journal editor demands. Because only when you know what is demanded, you will be able to serve that. So, sorry. So it's important because it helps you identify the journal, and it also helps you to be in a state where the journal is not trying to spend more money on you. Because if you don't do those edits, the journal will have to pay for those edits, and they won't accept your work. That's an easier way out for them. So if the journal guidelines are very specific for images, you have to align with those images, specifically with your case reports. Your de-identified images with clear labels and high resolution must be uploaded. Then wrong journal will be equivalent to text rejection. You have to align with journal guidelines, their word limits and their figure limits. Now, there are journals which are dedicated for case reports. These journals do not provide subscription mode because most of them are run by author paid fee and they try to keep it open access. Then there are specialty journals. It's tough to get into subscription-based specialty journals, but if your case report is novel enough, you can pick these journals. Then there are high-impact journals. For them, you need a rare case out or you need something which has been never done before. So if you're thinking that I've written a good case in my MBBS or in my MD and I can get that on Lancet, probably you need to think again and save your time by not sending it there. Then you must have a pre-submission checklist. Now, there must be care checklist, which we discussed. If that is included, at least your structure is sorted. So that is something which most journals require now. So that must be fulfilled. Then a consent statement or a consent form from the patient. Authorship as per ICMJE. Now, ICMJE has clear guidelines for authorships that have to be followed. And if you see, they have four sections, all added by an and. So only the authors which justify all those must be included as authors. Otherwise, they must be acknowledged. Then there must be an update. There must be a list of updated references with proper formatting as per journal requirements. Then you need to have a good cover letter because most journals do not read anything beyond your cover letter and abstract before thinking to send your work for a review, right? So for a cover letter, the idea is to convey how your thing is different. Rather than writing that you are submitting this and this, then this is what you found, this is the first case from your city. That's not something which an editor will appreciate. Your idea must be that you convey that I have found a case which adds this to the current body of literature and your readership may be interested in reading this. Plus the requirements which have been asked by the journal, like the word count or any specific requirements, because if you make the cover letter good enough, it forces the editor to read your abstract. Then your abstract stands the chance to make him interested in the work, or make him think on the work if it's publishable or not. Now, once you submit, it passes the review stage, and it gets to the review stage. The next thing you face are reviewer comments. Now, reviewers are experts in the field. So once your work is screened by them and you get comments from them, they are mostly in your benefit and must be done in a very polite way. So for that, a rebuttal letter is made. And the way it's made is that you start by thanking them for their time and support. And then you reply all those comments one by one. You start by writing the comment and then your response to it. Right? So a polite tone has to be maintained. You have to do it point by point. ये चल रही है ना, कौन सा चल रहा है आपका? मेनली चल रहा है, मेनली दिखाते हैं। लैपटॉप का ये ऑफिस में हटा दो। Okay, this is a sample cover letter we wrote for a case series. You can see we've introduced what we are submitting, in what category we are submitting it, then what is the background for the thing, then how our case series is there different, and also the literature. Then why this work is important. This is very clearly labeled. See, this is expanding disease spectrum, then there's practical relevance in the endemic settings, and then the clinical impact of the thing. Then we are affirming that the manuscript original has not been submitted elsewhere. All authors have approved the final version. And then we are just labeling that who is the corresponding author and how we are submitting it. So before we do this, I'll just tell you how to handle Mendeley. This is another plugin you need to install for Word. Okay, I need to do a more Microsoft entry. If this is not working, another way you can do it is you can just go to Mendeley and install it. Otherwise, we have an older version of Word on this, but I'll still tell you what it works like. So in Mendeley, you have these references inserted. The easiest way to insert these references is that you open any article on PubMed and use a digital object identifier. Say you want something PM 2.5-ish in. You can either search by author name or you can search by the name of your article, right? Use the most recent one here. So say if you want to cite this or use this article, we can use this OI, which is a digital object identifier. And then we don't need to insert anything on this. Just click on insert references. You can either download PDFs and upload from that, or you can enter it manually. Once you have the DOI, just copy, paste it there. Okay, sorry guys, I need to copy it again. Okay. So once you enter it here, it will pick the entire reference and you can just add entry. So once this has been added here, you just need to add that to the main document using the reference manager. And once those are added, they will put that in C sequence on that document. And even if you shuffle the paragraphs, or say a reviewer wants you to put one paragraph first and shift the next paragraph later, it will adjust it by itself. Or say if your journal manuscript gets rejected and it's to be submitted to another journal, you can change the entire formatting of references with a single click if you're using a reference management software. So that's what Mendeley does, right? So this is a short summary of how to handle case reports. If there are any doubts, please feel free to shoot them. I guess we can end the live stream here. Thank you, everyone. किसी को पूछना है कुछ? Okay.